Hi, this is Nigel Maynard, Editor-in-Chief of Drugstore News, and I'm coming to you on the show floor of Total Store Expo in San Diego, California. I am here visiting with the compliance team, and I'm sitting down with Sandy Canally. You are the CEO and founder of the compliance team.
That is correct.
Thank you for being here.
Thank you. Thank you for this opportunity.
Awesome. Now, let's just jump right into it. So, for our viewers who may not be familiar with the compliance team, give us an introduction about your company.
Okay, very good. So the compliance team is an accreditation organization.
Okay.
We're CMS approved in many areas. We accredit DMEs, pharmacies, clinics, and health departments. Been around almost 30 years next year. And always attend NACDS Total Store and are happy to meet with customers as well as prospective customers.
Okay, good. Okay, so you have a front row seat, so you see what's been happening in pharmacy, and there's a lot of changes taking place, and one of them is clinical services. That is a big deal now for the industry. Tell us, how is clinical services changing pharmacy?
Certainly, it's become more about filling the script so that you're offering services that are more clinical oriented to the patients you serve in the community, whether it be patients with diabetes, with hypertension, with high cholesterol, whatever the case is. They're doing things like point of care testing. They have been doing immunizations, but even that is expanding with doing the whole family, with having pediatric vaccinations done. So there's a variety of things that are essentially taking the pharmacist from a transaction-based model to a clinical-based model. And this all relates to the changing role of the pharmacist and pharmacy with legislation, with them getting provider status, with communicating more with prescribers, with working with the physicians as a team member, as opposed to, okay, just the drugstore down the street where Mrs. Jones goes to get her scripts done. So there's a lot more hands-on kind of counseling and help with, medication reconciliation, all of those things that the pharmacist is now an active role.
So with all of those changes then, it seems like your company will have a big role to play within that framework. So tell us a little bit about what that is for the foreseeable future.
So the role that the compliance team has taken as an accreditor and even offering certification is verifying and validating the quality behind those new programs so that the community, the payers, the referral sources know that this particular provider is an exemplary provider, giving service at that highest level possible, and that they're doing things right. In the case of a chain, you want to make sure that you're only as strong as your weakest link. So you want to make sure that you have that consistency in your quality, with your process, with your policy. Accreditation and certification gives you that validation.
And so you work with small pharmacies and big pharmacies?
Yes. So we have a lot of regional chains that are accredited by the compliance team, as well as thousands of independent pharmacies. One of the regional pharmacy chains that we've accredited for many years is Lewis Drug. And one of the things that we particularly like with Lewis Drug is the fact that they are doing clinical services. They are doing advanced practice and move with the times, even ahead of the times, and certainly are a good example of who is exemplary.
I am Jessica Strobel. I'm the Vice President of Professional Services for Lewis Drug. Lewis Drug has been a long-term customer of the compliance team. We are an accredited exemplary provider through the compliance team. We consider ourselves to be an innovative company, so we appreciate partnering with other innovative companies. The compliance team has had a long time reputation of working to advance the profession of pharmacy, and Lewis Drug has very similar interests. We're always interested in bringing to the table what a pharmacist can do for a medical team, and we align very well in our core values with the compliance team on turning the profession of pharmacy into something new and innovative in the future. So we look forward to a long-term relationship with the compliance team. We've worked with them for many years and will continue to work with them for many years to come.
So thank you so much, Jessica, for sharing your experience with the compliance team. And thank you, Nigel, for allowing us this opportunity at Total Store Expo.
Thank you very much, Sandy. Enjoy the rest of your show.
Will do.
Thank you.